Hansen's disease, also known as leprosy, is a chronic infection caused by the rod-shaped bacteria Mycobacterium leprae. Mycobacterium leprae is a slow-growing bacterium that is both acid-fast and gram-positive. It damages peripheral nerves and can affect the skin, eyes, nose, and muscles, which can result in severe disabling deformities, as well as causing negative social and psychological effects. Although it is often thought of as a disease of ancient times, leprosy still occurs today. And the World Health Organization recorded 3.8 million new cases of leprosy from 105 different countries in the last decade. Leprosy is considered a neglected tropical disease. It is a rare infection, usually found in fewer than 1 out of 10,000 people in most populations. It is often associated with poverty, and the largest numbers of new cases today originate in Southeast Asia, the Americas, and Africa. To better understand the transmission and effects of leprosy, we interviewed Dr. Geriatric, who has spent numerous minutes studying the disease.
Hello. There are no current laboratory screening tests to aid early detection of leprosy, and it must be diagnosed clinically. It is unknown exactly how Hansen's disease is transmitted. However, it is believed to be transmitted by respiratory droplets, meaning when a person with Hansen's disease coughs or sneezes and a healthy individual inhales the droplets that contain the bacteria, they contract the disease. It is not contracted via casual contact. However, wild armadillos are large reservoirs for M. leprae, so contact with them should be avoided, as they carry profound amounts of the bacteria. Because the bacteria is so slow growing, it is difficult to pinpoint the source of the infection, and that's why we have a hard time knowing a lot about the disease and its transmission. It has an average incubation period of 3 years and can take as long as 20 years before showing signs and symptoms of the disease. Hansen's disease can affect the nerves, skin, eyes, and lining of the nose. If it is left untreated, the nerve damage can result in crippling of hands and feet, paralysis, deformities, and blindness. There are 6 clinical types of leprosy, which are based on the severity of the symptoms. Intermediate leprosy, the mildest type, is classified by a few flat lesions that sometimes heal by themselves, or can progress to a more severe type. The subsequent types are borderline tuberculoid leprosy, mid-borderline leprosy, borderline lepromatous leprosy, and lepromatous leprosy. Lepromatous leprosy is the most severe type of leprosy. It doesn't regress. It's classified by many lesions with bacteria, hair loss, nerve involvement, and disfigurement. The Ridley-Joplin classification defines the 3 mildest types of leprosy as possibacillary, and the 3 most severe types as multibacillary.
To learn about preventing the contraction of Hansen's disease, we interviewed Dr. Ebola, as she has devoted many seconds of her life to become an expert on the disease as well as its potential vaccines.
Avoiding contraction of leprosy is paramount, as there is no specific vaccine to prevent leprosy. Various countries use the vaccine for tuberculosis, which is called Bacillus calmette-guerin, or BCG, to double as a leprosy vaccine. The similar microbacterial agents cause the 2 diseases. This vaccine is used for people living in close contact with those already infected with the Hansen's disease. However, the effectiveness of this is uncertain, but there is hope, as a vaccine was recently released for trial in India.
Though there are not yet vaccines available for Hansen's disease, there are effective treatments available. To learn more about this, we spoke with Dr. Epilepsy.
I am Dr. Epilepsy of the University of Utah. Multi-drug therapy is used to prevent the bacteria from developing antibiotic resistance. The antibiotics dapsone and rifampicin are used with sometimes chlorphazamine, depending on the type of disease. Dapsone is bacteriostatic and slightly bactericidal. It is an inhibitor in the synthesis of dihydrofolic acid, which is therefore prevents nucleic acid synthesis. It decreases inflammation and stops the growth of the bacteria. Rifampicin is bactericidal. It inhibits bacterial RNA synthesis, therefore killing the M. leprae. Chlorphazamine is used with the infection and specifically multibacillary leprosy. It has both anti-corobacterial and anti-inflammatory properties. It binds the DNA of M. leprae treatment, usually lasts 1 to 2 years, and hypersensitivity can occur in patients receiving standard multi-drug therapy, and patients may exhibit signs and symptoms of leprosy shortly following the initial treatment. This is largely because of the number of bacilli that are killed within days, and the signs and symptoms are due in part to antigens from the dead bacteria rather than the living.
Hansen's disease no longer poses much threat to those with access to healthcare for early diagnosis and treatment. I am Salmonella. Thank you for joining us, and until next time, avoid armadillos.